Hello everyone, my name is Rokas Kuprys. I am an oral surgeon from Lithuania. I'm also a practice owner, and today I would shortly like to talk about the digital workflow and how it can help to boost the income of the clinic. So, firstly, nowadays we live in a very complicated environment, and we can't imagine when it will all go back to normal and how the future normal will look like. However, it is a really good time to change the way we think and we work. Just look how fast the world adapted to do everything online. We don't only do shopping online. Nowadays, we have online business meetings, online conferences, we have games, movies, we have even schools, even dancing or swimming lessons, they're all in the digital world. So this situation pushed every business to react and adapt. The same is in dentistry. Uh, all over the world, we see many doctors offering online consultations, real-time conversations and treatment planning, and asking just for panoramic X-ray, especially in our country. Do you think it's possible to do a proper treatment plan having only this information? I think it's possible. That's an old school dentistry. But just imagine having a very easy to use treatment planning platform that allows you to do every step guided and a machine in your office that can in one scan can make you a full CBCT, an intraoral scan, facial scan, and a smile scan, then that's a game changer. So here's really the moment of choice, either to stay in the present or to jump to the future. I believe that every patient, especially after the crisis, will seek much more for the quality. So just imagine and try to put yourself to your patient's place, going to different doctors for consultations, and they all say the same for you. But one can do it immediate, can do it flapless, and can load it the same day. When I say that to my patients, they all say, wow, that's really amazing. And why? No one told me that before. So having all that digital tools and planning tools let you to create the wow effect to your patient. The wow effect is very important for you if you're a clinic owner because it increases your acceptance rate. Before we started to use the R2Gate, our acceptance rate was around 68, 70%, as we're not the cheapest in the area. And after we started using the R2Gate, the acceptance rate increased nearly to 85%. And the patients that don't accept the treatment, they just don't accept it because not because they don't like it, they just can't afford it. And then these patients goes out of your clinic. They are the best possible marketing for you because they talk about you to their family, to their coworkers. They say how unique you are, how they loved your treatment plan, and how they wish they could do it. So creating the wow effect is one of the most important things during the consultation. Uh, when you have all this digital information and digital tools, you can offer your patients to place and restore an implant the same day, because all the planning and printing is done before surgery. So your service is very unique and way different from others around you. What is also very important, it saves time, because it saves chair time, because all the planning is done not using the chair time, and it's done away from the clinic. So the chair can be used for service. What is also very important, you have less appointments for the patient. That is lower infection risk. So now I would like to show you a couple cases that we did using the R2Gate. And the first case is we had a patient that came in the clinic missing the central incisor. She came wearing the removable, and after the consultation, we did the treatment planning. We printed the guides, and we did the surgery, implant placement, bone grafting, soft tissue grafting, and loading the same day. So that's the view of the surgery. You see the guide and implant inside. And as you can see, the buccal plate is very thin. And with that thin buccal plate, we got very good stability and ISQ around 78. That is enough for safe loading of the single unit. So we did the bone grafting and soft tissue grafting and the loading the same day. So that's the single case. And the next case is the all-on-4 case, the upper jaw. The patient came asking for better smile. It's a perio patient. As you can see, we extracted all the upper teeth. We did the little bone grafting and put 4 implants and immediate loading. The planning of the case took around 30 minutes and the case itself around 2 hours. So the case big like that takes the chair time of 2.5 hours. That's really not that much. And the next case, also the upper all-on-4 case, we did extract all upper teeth and put 4 implants and loaded the same day. Also, the case with treatment planning and surgery and loading, 2.5 hours. So having all this digital possibilities, you can speed up your treatment. You can have a better quality because everything is planned and everything is done in one step, and you can lower your costs because the chair time is much shorter than not doing it digital. What is also very important, all the planning can be done outside the clinic, so it saves not just the chair time. If you outsource the planning to the planning centers, it also saves your time. It leaves you much more time for your hobbies and your family. So the time in our job is the most expensive. And by outsourcing the plannings, you just send it to the treatment, to the planning centers. After the treatment plan is done, you check it on your iPad, and if everything is good, you just send the confirmation, and that's it. After a couple days, the guides and the teeth are in your office. So you save lots of time during that. And as one smart guy told, your life does not get better by a chance. It's get better by a change. So I I suggest everyone to try and do it the other way, and I believe it will change the whole workflow of your work. So thank you, and hope it was interesting and useful for you. Thank you again.